That is an excellent question. And I would be asking the same question to my doctor. How do we know that exercise works for cancer care? Now, a study that was published in the New England Journal of Medicine in 2025 that looked at colorectal cancer patients, particularly patients who had stage 3 or high risk stage 2 colorectal cancer disease. Really, what that means is their cancer hadn't spread all around the body or to other sites other than the colon or close to the colon. Those patients typically would undergo surgery and they would receive chemotherapy after. So what the study did was really to randomize about 889 patients into two groups. And these patients had a median age of about 61 years. They were both women and men, and this was a study that happened in Canada and Australia and included several sites. What they did was they looked at 445 patients who received chemo after their surgeries. And those patients were assigned to get behavioral support sessions, but also supervised exercises every 2 weeks or monthly for a total of 3 years. And then the other group, 444 of those patients were randomized to or assigned to get only educational materials. This is a kind of study we call a randomized control study and is considered a gold standard for how we prove evidence in cancer care. Now, what they found is that at the end of this time, and after following them up for around a median of 80 years, they found that at the 60 months or the 5-year time point, 80% of the patients who had undergone the structured exercise program were still alive, but not just alive, did not have their disease return at that 6 year mark. And that compared to about 74% of patients who did not get that structured exercise program. Now, this is a very good study. At least it highlights here that with a 3-year structured exercise program, patients with colorectal cancers did well. Now you may ask, is this a study that I can apply to myself? Well, that is a very good question because this study ended up being a very long study for a total of about 15 years. And that's very typical and kind of explain why we don't have a lot of evidence in spaces like exercise, nutrition, in cancer care. These studies typically take a long while to happen. And another thing that was a limitation in this study specifically was that patients were quite fit. So these were patients who were quite fit, and they went into for the surgery and received chemo after and whatnot. So, of course, it shows that there are benefits with exercise, but again, one might ask that these patients were very fit.